Hi, I'm Dr. Jacob Teitelbaum, board-certified internist and medical director of the Fibromyalgia and Fatigue Centers. As part of treating fibromyalgia and chronic fatigue syndrome, we have found that many people with these illnesses have infertility and have gotten pregnant when we look at and treat the underlying parts of our treatment protocol. This has resulted in research looking at natural treatments for infertility that are also very effective in the general public. In this segment, we're going to teach you how you can get pregnant using natural therapies if you've had problems with infertility. Infertility is an increasingly common problem. In fact, the sperm count worldwide has been dropping by over 50%, in fact estimated 60% in the last 50 years. Once it drops to a certain point, there's not enough sperm activity for people to get pregnant. About a third of infertility is caused by problems with the sperm on the male side. About a third is caused by problems with ovulation and women's fertility issues. And about a third is caused by a mix of both. We're going to talk about just a few things today that you can do to get pregnant without having to do in vitro fertilization or in conjunction with it. But for more information, we invite you to go to our website at www.vitality101.com. Click on Health Topics from A to Z and click on Infertility. And there will be directions for both the man and the woman on lifestyle changes and natural things you can do that have a very high probability of resulting in your getting pregnant. For those of you who would like, we are also now recruiting couples for a research study that can be done by mail. And if you qualify for the study, if you're a woman 18 to 35 or a man under 50, and you have unexplained infertility, you can be in the study by mail. You will need to get certain common blood tests that you probably already have had checked, but we will then supply the natural supplements that are needed for free. So if you're interested in being in the study, contact us at endfatigue@aol.com. But you can go ahead and get the information on how to do these treatments on your own. And I want to look at just a couple things that are overlooked because they're cheap, so the doctors don't hear about them. But let's take a look at just some of the lifestyle changes that a woman can do. Did you know that if you have more than two servings of fat-free milk products a day, you can decrease fertility by over 80%? And a lot of you are pretty weight conscious, so you're doing fat-free milk or fat-free cheese or cottage cheese. Those are good, healthy things to do, but not when you're trying to get pregnant. A Harvard study showed that by using whole milk products instead of fat-free or low-fat, fertility can be markedly increased. In addition, several studies suggest that both soda and coffee act as birth control. You want to cut back the coffee. It doesn't say you can't have any, but keep it as low as you can. And the decaf is no better than the regular. Tea, which has caffeine, actually enhances fertility. So it's not the caffeine, but the coffee and the sodas should be avoided. In addition, you want to avoid taking vitamin A over 8,000 units a day as it can cause birth defects, and vitamin C over 1,000 milligrams a day can actually inhibit fertility, where lower doses are helpful. You want to get nutritional support. I recommend a vitamin powder called the Energy Revitalization System, which contains over 50 nutrients in one simple drink. It replaces over 35 tablets of supplements a day. It's available at most health food stores around the country and online. It can be found on our website as well. But that's simple nutritional support can make all the difference. In addition, you need to treat iron deficiency, and the blood test normal ranges are meaningless. Especially if you have hair loss, which is associated with low thyroid or low iron. But really anybody whose ferritin blood levels are under 60, or anybody with fatigue that's unexplained. Basically, if your ferritin level is under 60, a simple blood test, you must be on iron to help your pregnancy. A study showed that women with unexplained pregnancy who had ferritins under 40, the majority got pregnant simply by taking iron. In addition, a low thyroid is a common cause of infertility and a very common cause of miscarriages, despite normal blood testing. I recommend that any woman and every woman with unexplained infertility be given a trial of natural prescription Armour thyroid. Now, what can the men do? The good news for the men is that there is an enormous amount you can do to increase your sperm count. Number one, avoid soy products. Even little bits of soy like tofu or tempeh dramatically will decrease your sperm count because soy contains estrogen. In addition, you want to go ahead and use underwear that let the testicles hang free, because the reason the testes are outside of the body is they don't make sperm at 98.6. They have to be at 96 degrees or lower. So go ahead and wear shorts that are boxers that let the air circulate. In addition, avoid aspirin products or Motrin products because those inhibit sperm count. Research has shown that you can dramatically increase sperm count by simply taking things that improve energy production in your little swimmers in the sperm. One, acetyl L-carnitine and regular carnitine, 1,000 milligrams a day each, plus coenzyme Q10, and I would use the Energy Revitalization System vitamin powder because that has many nutrients that are helpful, and something called Ribose. Now, there are many treatments, both lifestyle changes and natural supplements, that will be dramatically helpful in your getting pregnant. And I invite you to go to my website at www.vitality101.com to see what you can do to have a baby right now. The good news is that these treatments are fairly cheap, use treatments that can be found anywhere. They're readily available and are very safe and effective. They can be done with in vitro fertilization or instead of IVF. So the good news is that most of you with unexplained infertility can get pregnant using natural therapies. I invite you to send us a picture of the baby once you have the baby. And if you'd like to be in our study, contact me at nfatigue@aol.com or on our website. This is Dr. Jacob Teitelbaum wishing you great joy and great health.